Welcome to the 4th Annual Iowa Ideas Conference. I'm Jennifer Daly, President and CEO of ICR Iowa, our region's economic development organization and the proud host of Inclusive ICR. Inclusive ICR is a coalition of over 114 members representing 57 employers from throughout the Iowa City, Cedar Rapids region. Our goal is to increase diversity, equity, and inclusion in our regional workforce. We are so excited to be hosting and sponsoring 11 sessions during this year's Iowa Ideas Conference. We hope you enjoy the conversations, make new connections, and walk away with some really big ideas.
All right, good morning, everyone. Thank you for joining us. Welcome to today's session. This is Providing Services in a COVID Era. This will be the first of 2 morning sessions today. Hope you enjoy the opening keynote with Carson King. We're really excited to kick off the rest of the conference. My name is Seth. I'll be the room host for this session. And before we get things started, I have just a few quick reminders. First, feel free to submit your questions and comments related to today's topic using Whova's chat feature, and I'll pass them along to the session moderator. Also, don't forget to use the hashtag IowaIdeas2020 on social media to share any insights and inspiration you may take away throughout the conference. And finally, there are so many interesting sessions during Iowa Ideas that you're probably not able to see them all. Well, good news, if you missed a session, they're all being recorded and archived on iowaideas.com, so you can check them out after the conference. And with that, I'm going to turn things over to our moderator, Adam Sullivan. Adam.
Thank you, Seth. Thanks to our panelists for being here today, and thanks to all of our audience members. I'm Adam Sullivan. I'm an opinion columnist at the Gazette. I'm here to moderate the session for you. I have a little bit of expertise in nonprofits. I used to work at a social services nonprofit, but it's not my main area of expertise, and so I'm definitely going to rely on my panelists to steer the conversations for us today. And I also encourage our audience members as we get going, if you have some questions for our panelists, enter those on the Whova site. Seth will feed those to me, and we'll get to as many as we can. So like Seth said, this is a panel focused on COVID-19 and how it affects social service nonprofits. A couple different focuses of that are the barriers to providing services during COVID-19, but also the changing and growing needs in our communities because of the virus and all of the ripple effects that that's had throughout our communities. So first, I want to take a minute to give each of our panelists an opportunity to introduce themselves. So let me start with Debbie. If you could introduce yourself and also tell us a little bit about your organization, please.
Well, thank you, Adam. I really appreciate being here today. My name is Debbie Craig, and I am the Chief Advocacy Officer for 4 Oaks. And I'm very happy to talk to you today about how COVID is affecting how we are working with the children and families across the state of Iowa. 4 Oaks has been helping children and families for the last 47 years, whether they're at risk, in harm's way, in crisis. We're one of the largest human services providers, and our teams work to provide services for over 24,000 individuals per year. 4 Oaks' mission is to assure that children become successful adults. So we empower those vulnerable children by working to help them become stable, self-sufficient, find permanency. They may have been struggling with poverty, unstable housing, underemployment, mental, physical challenges, academic delays. So at the bottom line, 4 Oaks helps them believe in themselves again and helps them expect success in their future. I'm looking forward to being here today.
Thanks, Debbie. James, could you take a few minutes and tell us about yourself and your organization?
Absolutely. My name is James Lee. I'm the Chief Executive Officer for the Boys and Girls Club of the Cedar Valley and primarily stationed in Waterloo, Iowa. We are a youth serving organization that supports kids primarily after school, but also during summertime and out of school time. Our focus is on the social emotional aspect of our youth of the Cedar Valley, and to also help with academic success. So we partner with our school districts to be able to provide our kids a fun place to learn and grow and to be responsible citizens.
Thank you, James. Emily?
Morning. Thanks so much for having me on the panel today. My name is Emily Blomme. I'm the CEO of Foundation 2 Crisis Services. We're located in Cedar Rapids, Iowa, and serve mostly Eastern Iowa, but a couple of our contracts are statewide. We've been serving Iowa for over 50 years, and we do that in a variety of ways, mostly through that's crisis mental health services. So we have a crisis phone chat and text service that's 24/7. That takes approximately 55,000 contacts a year. We have mobile crisis outreach, which is our program where we dispatch in person to help de-escalate and stabilize people in crisis. We have an emergency shelter for youth that serves 11 to 17-year-olds who are either system involved or runaway homeless or human trafficked youth. And then we have a program for youth who age out of the foster care system to provide some case management and skill building. Our mission is to be a trusted support when life gets tough for all people, anytime, every time. We have about 140 employees, and our services are provided, all of them are 24/7, provided at no cost to the people who use them.
Thank you very much, all of you. I'd like you to think back to mid-March when we first started seeing community spread of the virus in Iowa. So it started in Iowa a couple months before that with isolated cases that we were able to contract, trace, and contain. Eventually, it started to spread undetected, and we didn't know where it was coming from. And as you all remember, everything was moving very fast then, and it was really hard to know what was even going on. So it was right about St. Patrick's Day that the governor made orders to close down businesses and to restrict business activity. But if you recall, there wasn't necessarily clear guidelines for nonprofits at that time. And so every organization was having to find its own information and make its own decisions. So I want to start with Emily on this one. I want you to think back to those early days of community spread of coronavirus. Tell me where you were getting your information and what your decision-making process was like, and also maybe what you learned about your organization and your ability to act quickly.
Absolutely. So we took the majority of information provided by the Linn County Public Health Department and really relied on our local experts. That felt like the right thing to do for our organization. We had kind of a main focus of doing the best we could with the information we had right now, knowing that that information would change. And I think that provided our organization and our senior leadership team the belief that we could do it one way, and if we needed to change it, we could do it another way down the road, which we did. We have modified the way we've engaged with people consistently through this entire pandemic. Our senior leadership team met each morning, and we really tried to figure out kind of twofold. How do we keep the clients that we serve safe, particularly those who are maybe vulnerable, even vulnerable in health ways that we don't know about? And then how do we keep our employees safe? We were incredibly concerned from a business perspective of having workforce issues. So if one person getting sick in our shelter completely wipes out the workforce potentially of our shelter, and then we can't deliver the service, or if the entire mobile crisis team, gets sick, we can't uphold the commitment that we've made to the community. And so really trying to find ways that we could meet the needs of our people as safely as possible. And early on with a lack of PPE, that became really challenging. A couple things that we focused on also were looking at trying to get some policy out relatively quickly to provide some parameters for our employees. If people are working at home, what does a work at home policy look like when that might not have been something we had before? And so working really quickly to give our employees the information that they needed to be able to do their job well with a good, clear understanding of what the expectations were. And I think the last piece for us that we tried to focus a lot on was the well-being of our employees. They were afraid, just like we were afraid. They didn't know what was happening, and there was a lot of anxiety about the unknown, and would they keep their jobs and would they not. And so we focused a lot on really consistent, clear communication about what we were doing, how we were doing it, and trying to make sure that they felt well cared for, because it helps us continue to build the culture we want at our organization if we can keep them engaged and invested in understanding kind of the struggles that we're trying to make to keep everyone safe.
Thank you. Same question to you, James. Can you tell us about that early decision making and the big challenges in the first weeks?
Yes, for us, it was a lot of information coming at us from a lot of different venues. We had Boys and Girls Club of America providing information. We really relied on Black Hawk County Health Department to give us some direction as well. But our senior leadership team met in the morning and in the evening every single day to determine whether or not we were going to be open the next day for youth. And then I met with our site leads to kind of share that information so that there is a clear and consistent communication stream going to everyone as quickly as possible, knowing that we may plan in the morning to open up the next day, but that may change by the time we talk again in the afternoon. So a lot of time was spent having phone calls and conference calls and Zoom calls, trying to figure out what's in the best interest of our youth. The one thing that we kept hearing consistently from community partners was that the fear was that if we don't provide a safe space for our kids to come where there is that ability to social distance and remind to wash hands and wear masks and all of those things, that they are going to just go out and find their own way of social distancing. So we saw an uptick in our community of runaways for our kids. So it was even more important for us to be engaged in in opening our doors and providing that safe space. So we fought as long as we could before we realized that it may be better for us to take a moment, shut down, do some cleaning, and some training, and reopen a few weeks later. So a lot of the decision making was really changing very dramatically and very quickly for us. And what I saw come out of that is that our staff was super resilient and completely committed to serving our community in any way they could. In looking for the PPE and cleaning supplies, a lot of our staff brought in cleaning supplies from their home to make sure that we had enough to cover us for our kids. And we were only running 3 sites at that time. So it showed me how much our frontline staff, up to our management team, really cared about making sure that we meet our mission to serve those kids that need us the most. And so it's really, for me as an organizational leader, to kind of see that throughout the organization and the culture that's been created.
Could I ask a quick follow-up question? You mentioned an increase in runaways. Was that a pre-existing trend, or was that attributable to the pandemic?
That was attributable to the pandemic.
What is that dynamic like? I mean, do you know?
I don't have the exact figures, but what we were seeing is that there were more calls for runaways than actual service calls for accidents or other violence. In fact, actually during the pandemic, I think our violence numbers downturned in early March and April, but we were searching for kids that were even part of our club because they wanted that social connection, and they kept getting told, no, you have to social distance, you can't stay away. I mean, you can't be around other people. So it turned out that our kids were finding other ways to connect. And so it was important for us to try and keep our doors open. So we really worked with other youth serving organizations to try and see if we can leverage buy-in power with PPE and cleaning supplies, so that we can make sure that we're open for our kids, all of our kids in our community, and provide space. So it was an interesting time to see how dramatic it got with our kids wanting to try and connect with one another, because schools were shut down, and the longer schools shut down, the worse we saw it get with kids trying to find their way of connecting.
That's good to know. Yeah. Debbie, I want to turn the same question to you. And particularly, Four Oaks is on the bigger side in terms of personnel and physical footprint. And so kind of making those decisions on a larger level. Can you speak to that?
Absolutely. Four Oaks works very closely with our funders because they issue the guidance for operating in this new world and included amending a lot of the contracts so that the services could be provided safely. Our state and our federal funders released their guidance that we followed in relation to when we could have in-person visits and other appropriate protocols. But that took a high level of communication and collaboration between all of our different funding streams and contracts. So like James, we put together our COVID leadership team that met morning and evening to really address the current status, what had happened the night before, what had happened during the day. We also tried to guess what the future identified needs were, but we all know how difficult that was, and then tried to map out the gaps and the changes that we need to make. We put together protocols and procedures similar to what Emily was referring to that we put in writing and dispersed across our agency because it was so important that across sites, we have 20 sites across the state of Iowa, that we were consistent with all of our programming. We also then put together a newsletter that went out to our employees multiple times a week that updated them and informed them on the procedures and protocols that we were putting into place. Because again, similar to Emily, staffing plans had to be put in place because if we had staff that tested positive, we can't shut down. So we had to have staff in the wings. And sometimes that was administrative staff being ready to jump in and help in a program if they needed to. We had to work with our different community agencies because we move children between agencies. They may be in a community-based program and move to a residential setting, or they may be in a residential setting and are moving to detention. So it's very important that we worked with our local agencies closely because safety was at the forefront. And then the last thing I would share, again, and I know Emily shared as well, is that not only did we want to support the families and the children we serve, but we had to address the anxiety of our own staff. So we needed to keep them strong and healthy so that we could continue to support the families that we serve across the state. So we have our own staff that are trained and licensed in trauma-informed care and restorative practices. So we were using our own staff with our staff to manage their uncertainty and anxiety so that that way our staff felt strong and safe, and then they had the energy to be able to address the needs of the families we serve.
Emily, I want to ask you to jump in on that. That's your wheelhouse is kind of, emotional health type issues. What are some tips for nonprofits who see that their own staff are experiencing higher levels of anxiety as this drags on? What should they do?
That's a great question. And we have seen not only nonprofits, but even for-profit businesses really struggle with knowing how to meet the needs of their employees when they're experiencing mental health challenges. One of the things that we're definitely noticing is people who had no diagnosed mental health condition before the pandemic definitely are experiencing some struggles now with either depression through isolation or anxiety through kind of managing the unknown. We always think that providing a safe space to have those conversations is important. Stigma is such an enormous contributing factor to people not being able to share what's going on with them and share their own struggles and share how that's impacting them at work. And so having a safe place where someone can say, I'm really struggling because my energy's really low because I'm depressed and I just can't seem to figure it out on Monday mornings. So making sure that organizations can provide flexibility when they can to ensure that they can help meet the needs of the people that they serve. And then I think one of the things that I think is most important is leaders being vulnerable and talking about their own stuff, which I think is kind of an, the old school mentality is you just don't do that. But what we found is that when leaders can step up and say, I'm struggling with my own anxiety, this stuff is really tough for me too, a lot of our employees feel much less alone, that they're not the only one who's dealing with these struggles, but that even people like the CEO of a human service nonprofit that focuses on mental health really struggles with some of this stuff. And so that vulnerability lends itself to kind of normalizing a lot of what other people might be experiencing.
Thank you. I want to ask a couple questions about the way that the pandemic is affecting the people you serve as it drags on. James, the families you serve, a lot of them are income insecure, even in good times, right? And so now that there's a pandemic, there's higher unemployment, there's more anxiety, there's new childcare needs, there's, schools have been canceled. Can you just tell me what how the needs of your community are changing or maybe growing in the past 8 months?
So with us reopening, and then also some of our other youth serving organizations reopening, we reopened with smaller numbers to serve so that we can create those opportunities for social distancing. So whereas last year we served over 1,000 kids, this year we'll be lucky to hit over a couple of hundred kids, simply because of the ability to try and provide that safe space among 3 different sites that we actually managed. We also have some school-based sites that we couldn't actually access because the schools were closed. So we can't run programs in a closed building because that was purposely done. So that meant that there was even a greater need for our facilities, our own facilities and managed facilities to be utilized. What we've experienced is that we've had to create a waiting list for families to now access our services because, again, the hesitation of increasing numbers is are we out of the increased numbers of COVID cases, or are we starting to see that downtick? Do we want to be a super cell for the spread of it? So what we've experienced is that there's still a greater need for childcare and for safe places for kids to go. So right now they've been unable to access a lot of those services, and so they've just been kind of making their own way.
Do you know, just on an individual basis for the kids who are able to get served by your program right now, do you know anecdotally, are they under higher levels of stress? Or are they coping with this okay?
They seem to be coping with it well. We have seen since businesses have been reopened and schools are back in session, that we have seen some uptick in gun violence within our community. And so our kids have been more focused on that and other national issues more so than the pandemic. But they are actually, minus the occasional reminder to pull up your mask or it's time for us to go wash our hands, they're pretty well adapted to this new normal. Whereas as adults, we still have to work through our new normal and trying to adapt and be more equipped for it.
Yeah, Debbie, you weigh in there. So you work with youth. Do you find that they maybe actually adapt easier than adults to some of these changing situations?
Oh, I absolutely agree that they do. They go with the flow a lot easier. But I will say with our residential services, when it was determined early in COVID that we needed to lock down, we had to provide that increased staffing since the kids were now, as James said, all of a sudden they weren't in school. But in our case, then the kids also weren't allowed to go home on the weekends. So then you've got these youth that can't go home, and there's almost that physical disconnect between them and their family that they weren't expecting. So, that was more difficult for them. But, seeing their family, trying to make those connections, that's critical in their treatment process. But thank goodness that didn't last long, and we were able to allow them to go back home relatively soon after that. But it was still challenging. I don't want to limit the challenges that the kids did have, because I'm trying to think of an example. So let's say out at our Smith Center, it's a residential setting, and all of a sudden you are going through we can't see our parents. We can't be able to talk with our juvenile officer or our DHS. So we had to look at iPads. We had to purchase iPads for the youth, and we also had to give them a safe space so that they could have private conversations with the detention officer or their families. But then we also, on the flip side, had families that needed assistance as well. So they may have needed help with their phone or phone minutes. So I think what was key is just having them feel safe and having them feel secure, because then they're very pliable. Then it's like, oh, okay, I can't go home, but I've got this iPad and I'm calling mom, I can do it. So then I think they do make that change maybe a little quicker than adults do. But I do think it's important for us to provide that feeling of safety. Then I will say, though, once things loosened up a little bit and they were approved to go home on visits again, we had to work with DHS, because we didn't want any additional potential for virus spread for them to go home and then they come back to a residential setting and we're spreading it on to our unit. So again, it goes back to those protocols we put in place, making sure they were consistent with all of our programming and all of our staff. But then we also had to work with the state to say, let's say a youth did get to go home and be with their parents and tested positive while they were at home. We had it approved with the state that they could remain at home so that they weren't bringing it back to the units. So yes, in answer to your question on are they more, did they seem to adapt a little quicker? But I also think that adaption came with a feeling of safety that was provided through the trauma-informed care training of our staff.
Thank you. Emily, I want to go back to you. As I mentioned in our pre-interview, I used to work at an organization that did crisis call and crisis chat, and it's interesting the way that the calls can sometimes be like almost a barometer of what's going on in the community. Can you talk about the way, the volume of contacts that you had, but also how the content of those contacts has changed during the pandemic?
Absolutely. I'm not sure we knew exactly what we would get following, the start of the pandemic, but I think you're absolutely right that there, the world and the experiences that people have when they call us really is kind of a barometer for what's going on. We saw an increase in call volume. Just from a data perspective, in April of 2019, we took 3,879 calls. In April of 2020, we took 4,536 calls. So a pretty significant increase there. We saw kind of a myriad of issues. We saw some isolation, depression as it related to isolation, people who were used to having connections that didn't. We had an increase in callers from frontline responders who were really struggling, particularly in the medical field, nurses and nursing assistants who were working at assisted living facilities, was a population that I'm not sure we had identified had reached out before, but definitely when they called, they identified what their role was. The anxiety piece of people trying to manage the uncertainty, which I think we're still seeing a lot of. I'm not sure any of us thought we would be here still in October. And so, not knowing what the kind of track of the pandemic looks like causes anxiety for a lot of people. Relationship issues was another huge piece. Parents who are home with their children when they aren't used to being home with their children. There's a lot of family issues that came out of that, or relationship issues. I was talking before all of the attendees got on that my husband is a really lovely man, but we are not meant to work in the same space together for months at a time. And so trying to manage relationships when they present differently because you're in the same space with someone and you're in the same space with your kids and you're told specifically, like, don't get out and don't be social. That rubs on people wrong. And I think it really takes a lot of skills to manage those interactions well. I would also say that we saw quite a bit of grief and loss, people who are grieving their old life, the normal life, the experiences that they're used to having that they weren't having anymore. And I think most importantly, the pandemic, and if I were to throw the derecho kind of compounded on top of that, these are not situations where the mental health fallout is days or weeks, but we're talking months and years down the road where we're actually going to see this. I anticipate suicides increasing. There was some increase during the beginning of the pandemic, but I think that will continue to be a challenge probably across the country as people kind of sort through the losses that they've had and what that means for them. I guess the only other thing I'd mention is that we don't always know who's calling us or reaching out, because anonymity is a really important factor in people feeling safe that they can disclose what's going on with them or what's going on with their family. But we did have quite a few people who acknowledged that they were first-time callers, that they'd never reached out for support on a crisis line before. And that to me is an indication that, again, people who might not have had any major mental health challenges that prior to the pandemic are really struggling now, to the point that their coping mechanisms that had worked aren't, and they're reaching out to learn better and different ways to manage the anxiety and depression and other experiences that they have.
Let me dwell on that for a minute, because you mentioned nurses. So a lot of people would think, well, a medical professional must have training in this or resources through their employer. That's not necessarily the case. Can you respond to people who are, educated professionals who are doing well in their lives, but they still call crisis lines, and kind of the stigma around that?
Yeah, so I would say, and I think it's changing, but I would say that nurses and doctors in particular do not get tons of experience through education or on-the-job training on managing the mental health of the people they come into contact with. Unless it's an expertise, like an area that they have expertise in. I think that nurses and other kind of frontline people are exposed to a lot of different experiences. And when we have new experiences, including the fear of a major pandemic where we don't know exactly how it's going to impact people, who it's going to impact, how it spreads, the exhaustion of that, I think, can be incredibly challenging. And so, our hope is that anyone who needs support, regardless of who you are, regardless of, your socioeconomic status or the education level that you have, or, your gender identity, your race, your age, that if people need support, that they know that we're a safe place for them to reach out to, where they don't have to disclose who they are. What they share with us is up to them, and we'll support them based on that. So there are a lot of professions that have reached out to us during this. Bankers and lawyers and CEOs and people who I think a lot of us think, well, they totally have it all together. They have these resources and they have these connections, and they would be able to manage something like this better than most of us. But new experiences like this that none of us have really gone through, that unknown creates a lot of anxiety, and people, especially if that's new, people don't know what to do with that.
Thank you. James, I think we've kind of alluded to this a couple of times, but I want to come back to it because I think it's important. Your program's somewhat unique in that I understand you did a little bit of virtual programming, but really the meat and potatoes is that students are they're in person. It's really not replicable in a virtual setting. Can you elaborate a little bit more on why the in-person programming is so important for your organization, and also how you've kind of gotten accustomed to the precautions that are required with doing in-person programs?
About mid or the beginning of April, we actually closed down our sites to do some deep cleaning, some training and preparation, and do some virtual training or virtual programming for our kids. We tried that for about 6 weeks, and what we found out and what we heard from the kids, because we were still doing meal deliveries to them, so we were still taking breakfast and lunch to them and providing them with something to have for dinner for the entire family. What we found out is that our kids really wanted to be in our building doing our programming, running through our gym. And we took some time. We talked to, our local health department. We talked to Boys and Girls Club of America, and we talked to some other youth serving organizations and how they were handling or planning to handle, having kids back in, and then the wanting to be social, because we're social beings. We need that connection to one another. So how are we going to do that and do that safely, with ensuring that we can still do social distancing and wear masks? So we really drafted some policies behind that during that 6 weeks, and when we were ready to reopen, we actually saw a influx. That's when we reduced the number of kids that we would serve at each one of our 3 facilities to not even a quarter of the kids that we could serve in our building. And we saw that we filled up from each one of those facilities because the kids were eager to get back into our buildings and to get back into programming. It made it a little challenging for us because there, at the beginning, there was a lot of reminding of, hey, we can't hug on each other. Hey, you can't sit next to each other like that. We have to have space. And then to have the kids, especially when you're talking about, we serve ages 6 to 18. So the older kids is a little bit easier to explain than the younger kids to have to say, hey, you can't hug your best friend because, we're in this pandemic and the virus. And some of the conversations were being had at home and some of them weren't. So it was a new opportunity for us to share about this pandemic and germs and everything. So we started doing more STEM projects that actually kind of taught that to the kids. And what we saw is that the kids really enjoyed being still, even though they couldn't hug each other and walk side by side, but they could still be talking to each other face to face. It was a lot better than doing the iPhone calling or the Zoom calls and other social media kind of platforms that they have to try and connect. And for our staff, it was really great because they were eager to get our kids back in the building. So they did everything they could to make sure our buildings were clean. They were prepared. We put up additional hand sanitizer stations all across our 3 sites, and we increased the number of times. I think the recommendation at the time was 45 minutes hand washing increments, and we went to 30 minutes just to make sure that we added that additional time. So every 10 minutes there were kids lined up at the bathroom washing their hands. And we our staff just did everything they could to make sure that they kept the facilities safe and our kids safe. Which was really inspiring to see that their dedication and commitment to the kids and the community was that they wanted to be safe, but they also wanted to have a safe environment for the families that we serve.
So I think you said you're at about 25% capacity now. Do you think as long as there's community spread of the virus, is that about as much as you can do, or is there any opportunity to grow that with the space you have?
At our main site, we can actually increase that to about another 25. So right now at our main site, we serve up to 50 kids.
Okay.
We can probably increase that to 75 because we have a much larger facility here. Again, it's just the perception of, hey, we've got 75 kids running around our building, and people not really understanding the size of our main building gives us the ability to have that many kids. And we have enough staffing that we could handle 75 kids in our main site. So I think it's just more so the perception of increasing the numbers. What does that mean for us? And what does that look like?
Thank you. I want to talk a little bit about permanent changes that organizations are making because of the coronavirus pandemic. So at the Gazette, for instance, where I work, we've actually downsized our offices. So we will have more remote work moving forward. I think a lot of organizations are doing that. Debbie, you found that some of your programs work probably just as well in a virtual setting. For instance, foster parent programming. Can you talk a little bit more about that and why that just makes sense to do online moving forward?
Yes, we recruit and train foster care families for 69 of the 99 counties in Iowa. And the pre-service training during the licensing process is a 10-week process. But so during COVID, we started offering much of that training virtually and have found that, if we have the right technology, it is as successful with the families as in person. Some of those reasons is we don't have to limit the number of participant families to a particular class size like we had to before, and that trainers can train across multiple sites as well. It's proven to be beneficial for the families as well because these classes take place from 6 to 9 p.m. and that can present a traveling and childcare issue for the families. So taking these classes virtually have actually remedied those issues for our families. Now, I will say that there is some class interaction during that 10-week period that is a richer experience when it's in person. So we will, we'll balance that and use what we can virtual and then what we need to do in person. We also, with the foster families, once they are licensed, they're required to have 6 hours of in-service training per year. And the legislature regulates that only 3 of those 6 hours can be virtual. But again, it helps with trainers, it helps with the families to be able to do those 3 hours. Then thirdly, for this particular program is we have found our check-ins with our families. Normally, regulation shares that we're supposed to check in with those families twice a year. Well, we can do quick check-ins virtually much more often, and we find that we are checking in and, they walk around with their iPad and show us what the foster children are doing or a change they've made in the home. So it's making it capable for us to have a more often relationship with them. Because I will say that pandemic or not, children are continuing to come into the foster care system. And so the need for the foster families is going to continue. But unfortunately, the recruiting for foster families has been negatively impacted by COVID. That's one area where we really need to engage with families. And so we are struggling, to continue to find the foster families to support these families. The other area that I would say, similar to your example with the Gazette, is having sites, 20 sites across the state of Iowa. We have offices, as high north as Mason City, and we go west to Winterset. And in the past, you'd have those telephone conversations, but on a regular basis, you would want to drive and have a person-to-person conversation with those teams. Or now with Zoom and Life Size, depending on the confidentiality level you choose your virtual platform, it can be a very deep and rich relationship. You can see the classroom, you can see the students or the youth that they're working with. So and it helps then from a organization standpoint, cutting down on mileage and overhead costs. So I can see that we will be using that virtual experience on our own for that purpose as well.
Well, I'm having a very rich experience here with you three right now. So there you go. Do you want to do a quick plug, Debbie? If folks are interested in learning about fostering, where would they start that?
You can email me at dcraig@fouroaks.com, or you can look on our website, www.fouroaks.org.
Okay. It's a very important need. So, Emily, similar question to you. I realize that your counselors went remote at the beginning of the pandemic, and they might stay that way. Is that right?
That's correct. So when we realized that the challenges that a workforce issue would create if one of our call center employees got sick and then there was spread, we decided to work very rapidly. And within a week, we had 20 of our counselors working out of their homes. And so that included having a computer, and we have a very robust VoIP phone system. Routers, the cost to that was relatively expensive. What I will say is that there are some benefits to that. First of all, a lot of our staff prefer it. They don't have to wear certain things. They can work in their pajamas if they want. There's no commute. A lot of people, like to work with their pets, and there's a value to that. There's issues. There's no issues with space. Staff may be talking over one another on the phone. Fewer location logistics of simple things like toilet paper, or taking out the trash and recycling, or some of those types of things. Temperature preferences, which you wouldn't think would be a big issue, but when you work in the same space with someone, if someone wants it cooler and someone wants it warmer, that can cause some workforce challenges. The other thing is that operationally, moving to that was incredibly beneficial during the derecho, which I could not have foreseen whatsoever, but we lost the roof of our crisis center and we still can't work in that space. But it mattered less when we just didn't have people in that space and people were working out of their homes doing crisis phone, chat, and text. There are some challenges with that. There's some tech and troubleshooting challenges sometimes if an internet provider isn't as robust as we might need it to be with phones. There's some expectations that we have to, confirm. These are confidential conversations, so you can't be working at your kitchen table. And so trying to ensure that staff have a private place that they can work where there aren't children coming in or dogs barking or those types of things. I think that there's also challenges with keeping staff engaged with the agency. So normally if you have a staff meeting and people get to see one another and connect, there's challenges with that. There's also a safety piece that we've really had to work hard to address. We do active rescue many times where someone has already taken an active step to end their life when they place a call to us. And that requires coordination with one counselor staying on the phone with that person and another counselor making a call collaboratively with paramedics to ensure that we can get to that person safely. And so we've really we spent a little bit of time looking at what internal messaging system was one that would work for us and work well. And so being able to have crisis counselors who are all on working at the same time engaged in kind of the IM system where they can reach out for support if they need it. They also all are required to have a cell phone available to them so they could actually make that call if they had to. And so I think our plan is that the majority of those crisis counselors will probably stay in their homes, and we can use that as a recruitment tool as we struggle finding qualified people, both with education and experience in the Cedar Rapids area, because we've been here a long time. And as the need grows, I feel sometimes like we've oversaturated this area. It allows us to reach a little bit further across the state and potentially across the country to get qualified people who can work out of their homes and respond to people who are in crisis.
Thank you. I want to turn the same question to each of you. So the economic downturn related to the pandemic threatens funding sources. So governments will have decreased revenue in the next year or two, and they'll be looking to make cuts. You'll also have perhaps private funding sources and institutional funding sources that tighten up. So I'd like each of you to give a very brief overview of how your organization is funded, and then what challenges you foresee in the next year or two related to the recession and the pandemic. I'd like to go with James first.
So we're heavily grant funded. right now, and our effort was to kind of change that, to more diversify our funding, to really rely on more so of the individual gifts. So we had started that process at the beginning of this year, um, because after our grant funds comes our special events. And what we found is that we've lost our special events, and now our individual gifts have decreased as well because of the uncertainty of whether or not, people are going to have jobs tomorrow, or they're going to be laid off. So we're still really heavily grant funded at this point, and really trying to work with our grant funders, because when we applied for those grants, we applied with numbers that we absolutely had no problem with being able to meet, because we were on the upward trajectory of serving youth. And now with the pandemic, we're on a downward trajectory, self-imposed, because of the concern for our community, our families, and our staff. And so trying to have those conversations to rework the deliverables of those grants is kind of where we are sitting at right now with our funding. We're still trying to hold our special event. Our largest special event that we have every year is called our Harley Party. It's actually was supposed to be in May, and it did not take place. So we pushed it back to tomorrow. And originally we were going to do partially in person and partially virtual, and then we made the decision to do all virtual. So we're seeing a lot of our efforts being made to doing more virtual events rather than in-person events for our funding, to see if we can bring up our event funding bucket at least back to where it was when we were having in-person events.
Thank you. Same question to Emily.
Yeah, so we have some grants, some contract dollars, and then we also function with private donations. The interesting piece about mental health through the pandemic, is that I think more people recognize it's an important need now than they have ever before. People who have never thought about, donating to a mental health organization now experienced a mental health challenge themselves, or experienced someone they care about having a mental health challenge. And so we've seen a lot of opportunities open up for us where funding might not have been available before, but now it is. Also donors who haven't given to us in the past, that are specifically giving because of a personal experience that they've had. We did lose some funding as related to some events that we weren't able to have. I have found a lot of for-profit companies who provided sponsorship to continue that sponsorship, which has been a huge benefit to us. And I think that for many nonprofits, there is a struggle right now where we know that because the pandemic and the economic turndown, people might not have as much money as they once had to give. And if you combine kind of compound the derecho on top of that, people who had high deductibles or people who had to get trees removed, they might not have the dollars they once had to give. But I think that there's an increased awareness of the needs that human service nonprofits have, and the unique ways in particular that they serve the community. And so it's, we've had a lot of internal discussions about, do we still do an annual ask or do we not? And we've decided that we're going to continue to function the way we do, ensuring that if people want to give to our organization because of the important work we do, we've provided them that opportunity.
Thank you. Same question, Debbie.
Well, as I alluded to earlier, we have a lot of federal and state contracts. So those will continue. We will need to work to ensure technology is allowable in those future contracts, because though it may not be appropriate for all programs at all times, having that option in an emergency is going to help ensure the continuity of that contract. We also have a lot of organizations, local organizations, that have been that have continued to be very supportive. But as we all know, businesses are struggling and their capacity for giving may be shrinking. If a business is laying off individuals or wondering where they're going to be financially in another 12 months, supporting their local nonprofit isn't at the top of their list. But we have those partners that have just been there for us and continue to be there for us. It is amazing what this corridor, the type of partnerships that we have in this corridor. And it is, it's just really uplifting to know that they are still there for us. But then we have our private donors, but they're also affected. I just talked to a donor recently that she was so apologetic because she wants to give to Four Oaks and she's been a supporter of Four Oaks for so many years, but she's on a fixed income. And she's really nervous. How long is this pandemic and going to go on? And if it continues too long, will she have enough money for her own basic needs? So, it's weighing, these businesses and these individual donors, weighing their own personal needs, but there's some strong commitment out there. The nonprofits that have been here and that are making our community strong, we've really found that, they're going to continue to be here for us. And then I think I also forgot to mention grants, which my grant writer would get really upset with me if I forgot to mention that, because grants are very important. So that will continue as well.
Great. We are getting close to our time. We've covered a whole lot here, and I really appreciate all the comments you've had. It's been really insightful. I do want to make sure I give you each a minute or two to, if there's something you want to mention we didn't get to, or a parting thought for folks, and also make sure to tell folks how they could support or track your organization. Let's start with Debbie.
Oh, well, as I've mentioned, Iowa's children, that's who Four Oaks works with. And many of these children have known a life of child abuse, neglect, dysfunctional relationships. But when they come here and their very welfare and future are on the line, they know that we're here to support them. And at Four Oaks, we expect success. And so whether we do it in person or virtually, it is going to continue. We will continue to support the children and the families across this state because every child deserves that. So I would just invite you to please follow us on social media at Four Oaks Today, and visit our website at www.fouroaks.org. And I would be happy to talk to anyone that has questions. So feel free to give me a call or email me at dcraig@fouroaks.org.
Thank you. Emily?
Yeah, so, I think that I would just mention that there will be long-term fallout relating to mental health from 2020. And I think that many people who didn't have struggles before have struggles now. So I would just encourage everyone to be mindful of your own mental health, check in on the people that you care about, reach out to them and ask them if they're okay. And if they aren't, make sure that you can provide them a safe place where they can have conversations about what's going on with them. One of the most common ways that people use our crisis line is when they think, what do I do? This person needs help. And it's a great opportunity to together call the crisis line. So people can call our crisis line at 319-362-2174, or you can call the statewide crisis line, Your Life Iowa, at 855-581-8111. You can also go to foundation2.org. That's foundation2.org to learn more about our services and our organization, our volunteer needs, and how to donate.
Thank you. James?
So the Boys and Girls Club of the Cedar Valley is committed to supporting our youth to ensure that they have a fun, safe environment where they can learn and grow and be successful, and that we feel as though we are working with our community's most precious resources. And if we want to make our future leaders better, that we have to give them the platform to do so, whatever they define as being a leader within their circle of influence. So we're committed to doing that, regardless of how funding falls or whatever happens with the pandemic. We are still going to try and do everything we can to keep our doors open for our kids and for our families. We will hopefully be inviting volunteers in before the end of this month or next month to allow our kids to have other caring adults come into our facility. So if you're interested in volunteering, you can always check our social media, Cedar Valley Clubs, on Facebook or Instagram. You can also follow us, go to our website, which is cedarvalleyclubs.org, and always find out more information. You can always reach out to me at james@cedarvalleyclubs.org if you have any particular questions.
Thank you. I feel very, very fortunate for my very first virtual conference moderation to be with such fine panelists. I really didn't have to do anything. So it was really great to chat with all of you, and to I also want to thank our audience members and encourage you all to stay engaged with the rest of the conference. And I'll leave it at that. Thanks again.
Thank you.
Thank you.